So I stood there, and he said, "Passport or driver's license, please." And I gave him my passport. And they said, "Now you can walk through security. I am going to the White House." And they patted me down, and they asked me questions, and they took my picture, and I took fingerprints. I am going to the White House. And I went into a room that was a quarter this size with maybe 200 people, and we were there to witness the signing of a food aid bill, and I was representing food aid NGOs. And there were senators and congressmen and other potentates there, and President Obama walks out. And he looks at the group and he says, "There's a few people I'd like to recognize." And he said, "So glad that Senator Lugar, the esteemed senator from Indiana, is here. Please stand." And the place cheered. And he recognized a couple other congressmen, and then he looked over towards me, and he said, "So glad that Chuck has taken time from his busy schedule to be here." Pause. I just beamed. The President of the United States knows me. He doesn't know me well, but he knows me. To be known, to be recognized, not just flattered, but to be known even that little bit is just so good. We're so glad that Chuck is here and he's able to take time from his busy schedule. Chuck Grassley, Senator from Iowa, would you please stand? It was one of my fake Forrest Gump moments. But you know, in those 2 seconds, I experienced one of the deepest human needs that is not ego, not hurt, not insecurity. It is to be known. It is to be recognized. It is for something deep to happen between two people. It is to understand that you and I do not do health care. We do human care. That something deep speaks to something deep. And we deeply, deeply live in the intimacy of that relationship. This tie, I'm wearing this tie not because it goes with this shirt. I'm wearing this tie because Noe Ambrose gave it to me the last week I worked for Adventist Health. And he gave it to me, and I made a promise that the first time I came back to Hanford, I would wear this tie. I just didn't realize it would be with a yellow polo shirt. And in order to show my appreciation, but not to offend him for my poor taste, I will take the tie off now. But you know, I look at this tie, and my grandson says, "Wow, Grandpa, nice tie." This is a nice tie, not because of Saks Fifth Avenue, but because of Noe. That there is a human dimension to this tie. There is a human dimension to healthcare. And healthcare is not about medicalization and technology and technique only. It includes those things, but it includes the depths of the human heart. I retired 16 months ago, and I thought I was going to have this wonderful retirement journey, and for large part, it's just been great between grandkids and woodworking and getting up late and having fond memories. It's been good. But I had a midlife crisis about 22 years ago. It was when the Lakers continuously lost the world championship. But now I'm having a 3/4 life crisis because I've had a health condition that has just immobilized me. and going to doctors and rheumatologists and neurologists and internists. They had just ramped me up on steroids and then calmed me down with hydrocodone so that on some sort of human Richter scale, I'm kind of balancing out and I'm now just an even-handed jerk. It's been terrible. It's been a terrible journey, and I've been to doctors and physical therapists probably 150 times, which is 140 times more than I've ever been to a physician in my life. And 2 months ago, I went to my rheumatologist, and he opened up his computer, and he does all the right stuff. He shakes my hand and says, "Hi, Chuck, how are you doing?" He's taken the classes. He knows the technique. He's good. I like him. We talk about changing my medication schedule, and he's typing furiously on his computer, and he knows every 15 seconds to quit typing and look at me. He's got it down. He's good. And then he closed his computer, and he said, "Chuck, can we talk?" He says, "I think I understand the journey you've been on. You've been healthy your whole life, and now you're not. And I know your family is having to cope with you. They love me, but they cope with me." And he said, "Let me just talk to you as a friend. As a friend, you're my doctor. You're young enough to be my son." But he said, "I understand. Empathy is such a wonderful thing when it's not sentimental." He says, "I want to help you through this journey. Can we go out to dinner together?" My doctor. This was not efficiency. This was human care. And he talked to me and he said, "You know, you need to go meet with your family and you need to ask for their forgiveness right now because you're going to be a jerk for a few more months." I needed somebody to tell me that. I needed somebody who understood and that I had begun to trust. And then I began to realize that values are not the motivation for what we do. Values are what we do. That we don't do good stewardship and great integrity and heartfelt compassion in order to do better health care. Living out those values is intimate to health care. That we are all professionals in something. We could not exchange your parts. I worked for summer camp once, and every morning after breakfast, we had to draw out sheets of paper at random. You do pots and pans, you clean the latrines, you sweep the floors. If we went to work every morning and when you clocked in, you just got a random assignment. Okay, you do stints. You rake leaves. You do MRIs. You do meds. It would be chaotic. We have all been carefully tuned professionally to do our roles and parts. We are intricate and complex as Adventist healthcare. That is great. But we are all equal experts in being human. We are, that part of Central Valley is not just the topography of flatness, it is the community of being a flat community in which we have org charts, but we are all human. And what I need to connect with you in my healthcare journey is the human you, not just the medicalized professional you. We now know that soulcraft is intimate to the healthcare journey. That is why a book that I read just a couple, 3 weeks ago, called Humans Are Underrated, said that innovations in healthcare in the next 25 years will not be about technology, they will be about human social relationships. That human social relationships do not just improve patient satisfaction, that's great, do not create wow patient experiences, that is really great too. They are intimate and transformative for people changing in this world. That is why the Surgeon General said just a few weeks ago, we need more relationships in healthcare, not more machines. It's a bold statement coming from a public figure. He said, if only because those people who have relationships with their patients are more able to be part of their lives at the start of their long journey from overeating to inactivity to diabetes, from mild to severe depression that leads so tragically sometimes to suicide, that we are intimate to their journey. This is not a temporary fix. I want us to be more efficient. If you can be replaced by an app, you should be replaced by an app. That releases you, though, to be more human in relationships to people. What can really happen in Adventist Health Central Valley, in which our Adventist Health is doing so well, but our Central Valley, not so good? We are some of the healthiest people in Central Valley in this room right now, and the loudest, okay? That's who we are. You and I are called not just to increase patient satisfaction, not just to increase their experience, but to transform them. There are 3,000 of us here. Can you imagine how much we have infused and penetrated this community? All of us, no one in this community is probably more than 2 degrees of separation from some of you right here. We are embedded inside this community. What could happen if you unleash the deepest parts of your heart and soul with the people around you, if you call them not patients or colleagues, but brothers and sisters, and all the messy awkwardness of being a brother and sister, but all the kindness and generosity of being a brother and sister would all come together? 3,000 people can do that. Jesus only had 12. We have 3,000. Only one person in Tiananmen Square in China was able to stop all of the Chinese tanks. What can 3,000 people do? What if, in the words of Martin Luther King, we became revolutionaries and extremists for love and for health care and for human care in this community even more? I love those anecdotes. I love those stories. We just need more. It would be wonderful. Not if Gallup just came because we have 20% increase in our patient or our employee satisfaction surveys. They come. That's great. It's great that corporate now wants to come and see how we're doing financially. That's great. What if the whole world came here because they saw that we were creating intimate, integrated, human care right here? That we understand that it's when smart science and kind hearts clap their hands together that real health care happens. In the words of my friend Wilbur Alexander, some point in time, after we've rowed up the river so hard, so fast, with our best technology, we have to stop and let our souls catch up with us. It is scary to healthcare to talk like this because we need to be more efficient. We need better margins. But what we really need is for Central Valley to be healthier. And you are the ones God has called to do that. My last day in Hanford, I walked over to HR and turned in my badge and my key and said goodbye and walked over to the hospital to eat lunch because it's the cheapest restaurant in town, and I had been retired now for 16 hours. And I went over and said goodbye to Hannah. I don't know if you're here, Hannah, but hello again. And on the way, I was walking, a woman called out to me, said, "Sir, you help me? Can you help me?" And I could see immediately that she had one of those awkward, messy lives. And so because I no longer worked for Adventist Health, I no longer had to practice the 7 values, I no longer saw her as a complex human being made in the image of God, I said, "I'm sorry, I don't work here anymore." What are those sentences you wish you could walk back for the rest of your life? So she moved to the next person, one of the staff members, and said, "Would you help me?" And he said, "Yes." And he walked over to her, and she reached out her arms. And he came over, he hugged her, and they embraced. And I walked away, and I turned around and looked, and they held each other. It seemed like for 3 minutes, maybe it was just for a minute. This is not what HR wants to tell you to do, I understand. And I said to myself, wow, that's human care. I need to tell you that it was because human care had left the building at Sandefur Hospital. Because this woman was in the parking lot, not in the hallways. And the person that came and held her was a groundskeeper, not a nurse. We are all in this together. That when an invoice flutters from a printer, in billing, and a baby cries in maternity, it all connects with smart heads and kind and caring hearts. I want to close with this tiny little story. Someone asked me yesterday to tell it, and I love to tell this story. It's all about you. These little kindergartners were in art class, and they were doing fingerprinting, and they were painting, and they were squishing and wishing, and oh man, it's just so much fun making a mess. And the little boy looked over at the little girl and said to the girl, "What are you making a picture of?" She said, "I'm making a picture of God." And the little boy, who was a 4-year-old theologian, looked over at her and said, "You can't do that. No one knows what God looks like." And the little girl, who was an even better theologian, turned to him and said, "But they will now."